Hello and welcome. I'm Mariam, co-founder and CEO of Babbly. Today I'm bringing you another episode of interviews where I speak to experts from the world of child development and ask them questions that I struggle to find straightforward answers to as a first-time parent. For those of you who don't know Nicole is a cognitive behavioral scientist with expertise in learning disorders and attention. She intersects this knowledge with an understanding of context and culture to research and teach how people learn. She's the director of the Schwab Learning Center at Stanford University, founder and director of the UDL Innovation Studio, a hub where researchers, faculty, and technology developers can work together to develop ideas to educate all students as they prepare for their lifetime. Very excited to have you. I just wanted to start maybe by asking you to tell us a little bit about your research. What is the core research question that your research investigates?
So thanks for asking me to be here, Mariam. My research really centered on the role of reading fluency and extended time and processing speed many years ago. And it's taken a lot of iterations from that time to really understand what is the role of extended time. That took me to asking questions such as, why do people need more time when they do any kind of academic activity or reading, writing, carrying out a task for their supervisor or for their teacher. And decades ago, and even now mistakenly, people think that more time is needed because people read slowly, and that's not necessarily the case. And so the research that I've been involved in started with that. It still looks at those factors on how people learn and take tests and how they're assessed.
Okay, so can you tell us a little bit about the differences that people learn? What are those differences, and what do we know in terms of why people learn differently?
So there's a lot of learner variability around. I have studied specifically in depth students with learning disabilities. That includes dyslexia, but can also include those with math-based learning disabilities, writing disabilities, things that are called dysgraphia, dyscalculia, and other types of non-specific learning disabilities, as well as ADHD. All of those types of learner variability can really impact how the brain reads and writes and plans, organizes thoughts, carries them out, speaking, and in writing. But we also know more recently from research that even anxiety and depression can really impact how people perform academically because of that impact on the brain. And those same core areas, such as working memory and processing speed, as well as attention, kind of weave in and out of all this type of learner variability, including autism spectrum disorder.
And as you know, at Babbly, we often deal with children that are very young. I'm curious, out of all these learning variabilities, what are the ones that we can see the earliest evidences in children like toddler ages or even preschool? And yeah, maybe we can start there.
Children who tend to have significant learner variability in adults have the first signs at the age you're describing in terms of their behavior and language. So with language, you probably know this, with language, it's being able to use your first words, speak in sentences at a very early age, but then also behavior issues, because what often happens is students start to appear as if they're not paying attention, or they can get into trouble and not follow directions, but it's really linked to language or hearing. So it may be that they're not understanding what is said to them because of an central auditory processing disorder, or it could be that they did not understand the meaning of the words, which is different from just an auditory processing disorder and an articulation disorder. It's that they are actually not understanding what that word meant in a concrete way. Or they mishear words rhyming words such as talk and walk, or clothes and hose. Those types of words that rhyme can really trip little kids up in directions. And so one of the first things that we see is parents who think their children have a hearing problem because they haven't been following directions. But the hearing then is tested and it tends to be intact. This is separate, and hearing is separate from an auditory processing disorder. So they get their hearing checked, that seems to be intact, and then they start looking at language, which is why you often see specialists are speech and language, and hearing specialists often work together at that very early age. And language can then, like I said, take on a variety of different problems. They're having difficulty processing language that they hear because of the hearing or auditory processing component, if there is a hearing delay or a hearing impairment. Or they're actually having, even if those are intact, there are children who don't understand. It's more of the language itself, the meaning of language itself. They don't understand what is being said. And that is more in that communication disorder realm, which gets a lot less attention at an early age. But that communication realm is what I see manifest mostly into adulthood.
That's really interesting. I mean, I knew that the correlation between language and many developmental disorders such as autism, but what you just said even validates more how important it is to understand the level of understanding or receptive language, as speech language pathologists put it, and expressive language, because it can be an indication of a much broader set of variability or challenges. So would you say for something like dyslexia, my uneducated view of it is the first time that, you think about it, or you might notice it in a child, is when they start to read. Are you saying that actually there could be correlations to language, maybe receptive or expressive, in earlier ages, even before they start to read?
Yes, absolutely. Absolutely. In fact, but dyslexia is separate from an expressive receptive language disorder. Those are two distinct types of categories when you get into labeling, but you often see the behaviors overlap. And that's what usually fuels people to get an evaluation, is to tease out what exactly is going on. But you can see a lot of the behaviors overlap sometimes. There is an overlap in a certain percentage of people with language impairment that have dyslexia. But for the most part, the actual processing of language in terms of the meaning level or auditory processing can be intact in many dyslexic students. It takes on, in dyslexia, for some students, it takes on more of a visual or what we call orthographic component. So there's a lot of different names for that in the dyslexia world: surface dyslexia, visual dyslexia, orthographic dyslexia. So not so much phonologically based, as we have said for decades. So in order to say that a little bit more clearly, there is an overlap often between mixed expressive receptive language disorder or language disorders and dyslexia, and at a very, very early age before reading. It's hard to discern exactly what's happening. And that's why those key indicators that we talked about, which is understanding information and thinking that it's a behavior problem or the child is asking what a lot, is so important, because those are behaviors that you can see before text is introduced to a child, before the actual sound symbol correspondence is made and number sense is made, before that. And so when you think about it that way, numbers and letters are an abstract representation of language. So it's really important to look at those early intervention, those predictors that would require early intervention, because that's showing up before you would even introduce text. Then when you introduce text, letters and numbers, and try and pair language with this abstract symbolic language, that's where you can really see it multiply, and hence why a lot of students aren't even diagnosed or noticed until they're in kindergarten, first, second, and third grade, because their higher IQ has masked some pretty significant issues around language processing.
Really interesting. So can you tell us, what does the brain of a person who's dyslexic, I mean, how is it different than someone who's not dyslexic?
So we know that individuals who are not dyslexic tend to, who are in the average to gifted intelligence, because that's kind of one of the core definitions of dyslexia. You know, you have average to gifted ability and in the face of really difficult reading. So what we know is that people without dyslexia or typical readers tend to really rely on what we call rote sequential learning. And they're very good at it, rote sequential learning, rote sequential memory, which means they are, after a series of repeated practices, they can memorize their math facts. They can memorize the alphabet without knowing what it means. When we say A, B, C, D, E, F, G, etc., and 1, 2, 3, 4, 5, I mean, that really doesn't have a meaning by itself, right? But you can still remember it. That's rote sequential memory. It's like your phone number. With practice, you get it. We know that individuals with dyslexia aren't so good at that. They're better at other types of memory, you know, memory that involves context, which is meaning. So once I give some meaning to something, it's easier to remember. Once I give some color or experience to it, it's easier to remember. It's often called episodic memory, is something that is atypically high in individuals with dyslexia and ADHD. For many of them, you can't say for 100%, but for many of them. And this is confusing to parents because they can remember all the details of an experience, you know, where a family went on vacation, what the restaurant looked like, what the font on the menu was like, what, you know, what the conversation was, what people were wearing, but they can't remember their math facts. And this is a really confusing paradox for parents, because they think, why can they remember, why are they so good at this and they can't do this, which seems to be so simple. And it's the same thing with ADHD. You hear that question, how come they can pay attention to this and they can't pay attention to that? Well, it just so happens that, you know, the things that kids tend to be really, really good at, who have ADHD and dyslexic, don't require high levels of rote sequential memory and learning. So, or working memory. And if they do, it's presented in a way that has a lot of meaning for the child or young adult. So those are two big ways. This difference between the demands of rote sequential memory, which also gets more emphasized the longer you stay in school. I mean, you can, if for people who have gone to college, you can recall the tests that you take heavily rely on just memorizing. So you can have dyslexics who are super, super bright, but have difficulty taking tests because they're just not, they haven't learned the memory strategies that they need. They also tend to be more hyper aware. So when you look at recent research, it shows that individuals with dyslexia tend to distribute their attention, both auditorily, visually, and actual attention span focus much more widely. It's much more diffuse than individuals without dyslexia and to some degree ADHD. So, and you can actually look at this when you study movements in the eye too. But this has been really fascinating because this is why we speculate that many, many individuals with dyslexia and to some degree ADHD are very, very good at making connections among ideas of disparate parts that other people don't see because their focus was right where it was supposed to be, which makes them really good, efficient, fluent readers. Whereas this distributed attention tends to give individuals with dyslexia different kinds of strengths. They tend to be atypically good storytellers. They tend to think in pictures, which then can translate into slowing down how quickly they speak and put ideas together. Actually speak, but they tend to get to conclusions quickly by thinking in pictures, which is, again, a very interesting difference. So when you think in pictures, you can get to an answer more quickly, but you are slower at articulating how you got to that answer using words because you have to stop and translate the pictures into words before you speak. People without dyslexia don't have that issue because their words have the meaning. They're not taking the meaning from the picture and putting it into the words. They're just using their words for meaning. So very different types of thinkers. Dyslexia is not just a reading issue. People with dyslexia will say, I'm dyslexic from the moment I open my eyes in the morning till I go to sleep at night. It is how I view the world. It is a completely different way of experiencing the world.
That is fascinating. And I, as you were talking, I was thinking if there was a way to communicate your thoughts in a visual way without any words, they were probably much better at it than someone who's used to expressing their thoughts and communicating using words and language, which is what most of us do. That's really interesting. Thank you for that. So this idea of typical versus atypical is something that you and I talked before, and a lot of parents, whether they have an older child who may be struggling in school or they have a younger child who's nonverbal, really try to push for getting a diagnosis, or they might even fall in themselves into conclusions by comparing their child with others. And a lot of the times they think it's because a label or a diagnosis is actually a relief. I've heard a lot of parents will say, I'm relieved by that because now I can go and get more resources. At the same time, it takes away a lot of the attention on the right place, which is, without worrying about the label on your child, focusing on what they can do really well or their weakness may help them better. Can you unpack that a little bit? And tell us, where did this idea of typical versus atypical came from? And what do you hope parents focus on instead of a diagnosis?
Yeah. So good question. Everything you said is absolutely spot on. So I'm not going to repeat what you said, except to validate that it's a perfect segue into my response. We need diagnoses to qualify individuals for services, whether it be special education in school, additional 504 or IEP plans, which are formal, written, legally generated plans from schools, or even accommodations under the Americans with Disabilities Act on standardized exams. So that's when it benefits a person. And you're right, many parents feel like it's really helpful to know because then they know what types of services to get to intervene and have a really prescriptive plan with their intervention. I recommend to parents that it's very, very important that whoever evaluates their child, that they ask, okay, thanks for telling me that. Now I know what to help. What is solidly intact with my child? What is solidly intact to even extraordinarily high? And how can I continue to nurture and support those areas? That's question one. Question two is, how do those strengths intersect with the requirements of school? In other words, will those strengths be acknowledged and recognized at school? And if not, why? Help me to understand why. Because oftentimes what we find is students who do not fit into the way we teach at school, do not have their strengths recognized, because that's not where the emphasis on assessment is at school, which is really unfortunate, because the message that the student gets is, I'm not what I'm supposed to be, because they're not paying attention to what I'm good at. So all the stuff that I'm good at must not really matter to anyone. So it's very, very important that we reverse that messaging. The only way we're going to do that institutionally is to provide a lot more different types of education for our students and begin to honor that there is no one way of learning. We get the normalness from the statistical normal curve that we all learn in Basic Psych 101. There is a normal curve. Therefore, we think there is a normal, there is a typical. But when you look at Todd Rose's work, The End of Average from Harvard, you really get a sense that an average, whatever we call average, is an aggregate of peaks and valleys. So there really is no average. We only use that word to give us kind of an aggregate of what to expect for most people. For example, if I sell shoes, I know what the most widely, used shoe size is, for example. When I'm teaching in a classroom, I can say that this will probably speak to the broadest group of my students. But when you're really talking about how to meet an individual's potential, We really have to be clear on what are their individual strengths and needs, and that doesn't have anything to do with the diagnosis. But we do need to continue to nurture their strengths and identify them, recognize them. The third tip is teach your child that, or teach your student that, so that they can say, oh, I'm really good at this, and this is why it's not showing up here, but I know it shows up here. And then as parents, last tip is we have to change our expectations. Too often parents expect a mirror of themselves. If it's success, they want their child to mirror that success. And for some individuals, their lives are just not going to play out that way. So really understanding who a child is and giving them multiple paths to success so that they can be their own unique individual.
I remember once when we were talking about this topic, I mentioned, I wish I had told my son's daycare that my child is a visual learner, as opposed to everything else that I told them, because everything else was maybe a distraction. I'm curious if there are other ways, other, little nuggets or vocabulary that parents can learn on how to communicate their child's way of learning or their strengths, to your point. Anything that might come to your mind?
I think it's really important to encourage teachers that if they have to reteach something to a student, to try and use a child's personal interest for an example. An example is I was recently tutoring a college student in research methods and statistics, and he's a skateboarder. So all the examples that were in the book were rephrased using skateboard terminology and sports competition terminology. So really helping teachers to understand what are their individual strengths, and what are some ways that you could use those strengths to create examples to help reteach. That may even be, if you're teaching reading, using words that are already in the student's vocabulary because of their interests, whether it be cars or dance or mermaids or dinosaurs or whatever it is, to teach reading. So have them work with vocabulary that is already friendly and familiar with the student to actually teach them what word meaning means. So start something that's friendly and familiar to the student until you branch out to something that's more abstract. Visual learners, visual learner is one type of learner, but then what does that mean? That means that it will help them to draw a picture or see a picture, or to maybe use hand gestures more. That's one. So it's not enough to say this is a visual learner or a mathematical or musical learner. So what would that mean? So helping the teacher to generate, how would that knowledge translate into real practice? Because it's one thing to use a term or a label or to talk. It's the application that makes the difference in real life, the application of that knowledge. So how's that going to play out? It's what I call the rubber meets the road explanation. So what does this really mean in terms of what you're actually going to do? There are so many other types of strengths, we can talk about, and encouraging teachers to give students multiple ways. This comes from the framework of universal design for learning, giving students multiple ways of demonstrating their knowledge, whether it be a slide presentation or an advertisement or a project, a 3D project, as opposed to just a test. And there are ways, when you get into the world of universal design for learning, there are ways to give students choices to demonstrate their knowledge while keeping the inherent components of the assessment the same for all of them.
That's great. I think what you pushed me even further is to get beyond terms like visual learner or social learner, and to your point, think about the application and the potential scenarios that plays in different contexts. And I was thinking, if somebody goes into college or in the workforce and they say, this is how I learn, or this is how best I perform, do you think people in reality are more accommodating to that? Or if someone goes and says, I'm dyslexic, or I'm autistic. Because I think on the other side of the conversation, there are other people that, whether it's teachers or colleagues or bosses and managers, they need to also learn to work with different learning's variability. And I'm wondering, in your experience, what has been most successful?
So what has not been successful is for people to say, I am this, fill in the blank diagnosis. Because to someone who's not in that world, they have no idea what that means. They think dyslexia is a reading disability, so they don't understand, why do you need more time on math? It's all numbers, right? Or even if you say, this is how I learn. In my experience, it's most successful when people say either one of those two things first, followed with, so this is what I need from you. I need you to be able to allow me to sit at the front of the class because I track you, because it's hard for me to follow along when you're talking. And I'm actually, even though I'm not hearing impaired, I'm watching your lips move. I'm watching your face, right? That type of thing, which we see a lot of adults still do that had early expressive receptive language problems. They still kind of track mouth movements and use that to help facilitate a processing of language. Or say, I'm dyslexic, so it's really helpful if you show me, if there isn't already, the book is in electronic format, you tell me where I can access it, because I use software to help me listen to whatever you're going to assign. Or I have a language disorder and I have to listen to over and over again the lecture, so I need permission to record your lecture, or if we're going to be doing this over Zoom, I need permission to record the lecture so I can hear it over and over again, and this is an accommodation I need. So those types of things. It's again, the rubber meets the road is, forget the language. People aren't in our field, don't know what you're talking about. It has to be unpacked to a level where where it has to come down to the behavior. What behavior do I need from you? And do you need from me?
That's very helpful. Thank you. I think now I want to go a little bit. So far we talked about, the learning variabilities, what we think parents can do to help their child. Now from an institution standpoint, first, why do you think as a society we're so obsessed, especially our healthcare system is so obsessed with diagnoses? A lot of people ask us, what exactly are you trying to diagnose down the road with Babbly? Versus understanding the broader context of language development in infants. And what do you think we can do to change that, if we should?
So diagnoses really are fiscally generated for the most part. The need for them is usually fiscally generated. It's how healthcare is reimbursed. It's how schools are funded to provide services outside of their general education classroom. Diagnoses have a direct link to economics. So in many ways, we need them to qualify for a service that has not yet become a part of either our healthcare system or our educational system. In other words, we do not necessarily have a medical system that looks at wellness as part of a diagnostic culture, right? And I think we can all, that's not necessarily a bad thing. I mean, we need to, in serious medical situations, we need to diagnose and solve the problem immediately, right? There has to be a medication, a therapy, a treatment, etc. And a diagnosis is a set of symptoms that helps us drive effective solutions. So we need that. But we also have to recognize too that because that's the motivation, we leave out a lot of the wonderful things that we can do, both medically and educationally, that are not necessarily a part of that economic equation until you look at how doing those things that are more based on a strengths-based model and what's intact can alleviate over time the burden, the economic burden. And I hope that's making sense. I'm speaking in kind of a big picture terminology, But part of the issue that we have is much of what we do is, they're fiscally generated definitions. They're economically in place to help the healthcare and educational system. So the more we can really help teachers and doctors understand what is intact and how this one diagnosis is part of a lot of other things that are going on in this person's life, and how to leverage those strengths to support what we're trying to do in a narrow medical or educational model, the better we will be. And that's a longer conversation. It's something that that I'm working hard on in another private venture, Potentia, to do, so that we can move away from a medical model and just be looking at leveraging people's potential. But right now we need both. But I think we need to be moving definitely towards a model where we can stay focused on what is intact and how can we keep doing that? How can we use what's intact to leverage that to support the areas that need to be strengthened while we are strengthening what needs to be strengthened. Not to say that if we just focus on strengths, everything will be fine, because it won't be. But we do have to have a complementary model.
And I think that was my follow-up question, which is, if we focus on the strengths, and I knew you were going to say, we're not going to ignore the weaknesses, but in this new world where we're going to focus on people's potentials, what do you think will be the success metric? Like, what should we track and measure as a success criteria? Is it how further people excelled in what they're good at? Or is it a more holistic wellness approach towards, was their full potential fulfilled, plus what other areas have been improved?
Yes, and yes, and yes. I think it's the wellness approach. We definitely have to look at, is this person well adjusted? What is the level of anxiety? What is the level of anxiety, depression? Is this person well adjusted and able to continue to take calculated risks to articulate their potential in a healthy way? Are they able to pursue things that are meaningful to them? Ultimately, in my opinion, the measure of a success is a purposeful and meaningful life. A purposeful and meaningful life. And I think those simple words say a lot. A purposeful and meaningful life is still going to have levels of anxiety, because that's reality, but it's not anxiety that's produced by a constant sense of low self-worth and frustration. And it's giving people the opportunity to joyfully be really clear about what's important to them and craft a life to pursue what is important to them. And I believe that a person can be personally, socially, financially successful and create a purposeful and meaningful life in many, many ways, not necessarily in the traditional forms that we think.
I really cannot emphasize how important it is, the message that you're trying to convey, both bottom up and top down. I think my takeaway from this conversation was bottom up by empowering families and children or adults to advocate for their needs and communicate their needs better. It will hopefully make a change in terms of educating others on differences between learning abilities, but also top down by informing doctors and educators and teachers on the importance of paying attention to these people's needs. Hopefully we can drive a systematic change. I thank you so much for your time. Is there anything that I should have asked or you wanted to add, whether it's with your research at the Potentia Institute or broadly speaking? It's all yours.
No, I think you asked really important questions that were important to me, and address answers and issues that I'm always trying to get out there. So I appreciate your questions, and I wish you continued success with your wonderful work at Babbly.
Thank you, Nicole. Thanks so much.